Hi, my name's Ed Shanshala. I'm the CEO of Ammonoosuc Community Health Services. At ACHS, we provide primary preventive health care. We do so that each of us can stay healthy. Why each of us stay healthy is a very personal and unique story. The following is a personal and unique story of one of our friends, families, or neighbors and why they stay healthy.
We all know that we're supposed to go to the dentist and get, our 2 times a year checkup. Not everybody makes it there, and then, things kind of get tossed to the wayside, and then things may progress. And of course, it's expensive when you want to have a tooth fixed. It's a lot less expensive when you have a perfect mouthful of healthy teeth. So definitely prevention is key. Something that a lot of people don't know is that cavities don't hurt until it's usually too late. And so unfortunately, I'm seeing a lot of patients that come in that have waited too long. You have your enamel layer on the outside of your tooth, the dentin layer on the inner layer, and then the very inside layer is the pulp and the gum, the nerve tissue, blood vessels, and all that stuff. So if you have a really large cavity, and then it gets to the nerve, that's when you start to have a toothache, not when it's a small cavity that's fixable and preventable. Finding dental care up here has historically been more difficult for people in recent times, especially when COVID hit. It became even more difficult. People had a lapse in their care because they weren't seeing their dentist, and they might have missed that 6-month checkup and then let things go for several years. And so we're still seeing people trickle in that are trying to get caught back up on their care. It's been great to have this collaboration between Midstate and Ammonoosuc. It's even better for the patients because patients will come to Ammonoosuc for their whole body healthcare and any services that they offer. And while having dental nearby, me as a dentist, I can communicate with the physicians. It's a more we're able to more easily bridge the gap between care, so we can follow up and make sure we're treating the whole body and not just the mouth at the dental office, and vice versa. Earlier in April of 2023, they recently expanded Medicaid and offered dental services to adults, which is a really great thing. And since then, we've been able to help a lot of people who otherwise weren't able to get dental care. And with seniors, especially, the older that one gets, there may be some dental concerns that have been left to the wayside. Things might culminate to bigger problems once you get older, if there's been some neglect involved or just inability to access care. So a lot of older folks can benefit. When we have older patients in our chair, we have to be really careful about taking into account the risk factors that may cause certain dental problems to become worse. So if you're taking a lot of medications as an older person or even as a younger person, many medications can cause your mouth to become more dry. And when you have a dry mouth, then you're going to be at increased risk for cavities. When you're an older person and you are missing more teeth, we found that there's a correlation between missing teeth and dementia as well. And so, in addition, when you're missing teeth, it's harder to have great confidence, it's harder to chew, it's harder to, just overall function and have healthy nutrition as well, which can affect the whole body.